Welcome. Let's look at the clitoris. The clitoris is a sensitive region of the female external genitalia. The homologous structure of clitoris in male is the penis. In this lecture, we would be looking at the different sub-regions of the clitoris. We would be looking at how the clitoris is related to the penis, and also highlighting some other features that you should know about the clitoris as students of anatomy. Say that the homologous structure of the clitoris in male is the penis. So we can refer to the clitoris as the female penis. If you look at this configuration, you see that it looks different from what we believe the clitoris looks like. And if you look at the image down here, this other side, this is the configuration of the penis. This is what the penis looks like. Even though the penis is the homologous structure of clitoris in male, we have some distinct differences that they exhibit. If you look at the penis, you see that the urethra, specifically the spongy or the penile urethra, runs through the length of the penis. And this is what is highlighted here in dotted red. If you go back to the clitoris up here, you see that the urethra does not run through the substance of the clitoris. Rather, it is seen to be opened into the vestibule. This is where we have the opening here created between the two limbs of the clitoris, and this is where we have the vestibule here. Within the vestibule, we have the opening of the urethra up here in the anterior region, while in the posterior region, we have the opening of the vaginal canal. So you see that there are distinct differences, even though they tend to present similar configuration. The clitoris is structurally made up of erectile tissue and also nerves. And this is why it is seen as a sensitive region. So you have a number of nerve endings in the clitoris, and this is why it is sensitive. It is also important for us to add that about 80% of the entire structure of the clitoris is embedded inside the body. And this is why we say that the clitoris has an internal part and an external part. The external part is what is seen on the outside, while the internal part is embedded within the body. The internal part takes the chunk of the clitoris. We have about 20% of the clitoris in the external part. We try to use this image up here. This is where we have the external part of the clitoris, and this is specifically referred to as the glans of the clitoris. So this is the glans of the clitoris, and this is what is seen on the outside. When we have the remaining sub-regions of the clitoris embedded within the body, and this is referred to as the internal part. If you go back to this lower image, this is where we have the glans of the clitoris, and this is what is also carried here in yellow. So you see that the glans of the clitoris is what we see on the outside, and this is what most of us project as the clitoris, but this is just a very small chunk or sub-region of the clitoris that is referred to as the glans of the clitoris. And if you go more inferiorly, you have the opening of the vestibule, which is also what is created in this superior image. We say that the limbs of the clitoris is seen to be separated, and this separation is what gives way to the creation of the vestibule. So you have the vestibule created around this region, and within this space, we have the opening of the urethra in the anterior part, and posteriorly, we have the opening of the vaginal canal. This kind of configuration is what is seen in this upper image. So if you try to fix this clitoris above here into this external genitalia region, you see that the glans of the clitoris is what we'll be seeing on the outside, while the remaining sub-region are embedded within the body. And if you look at it, we have a space created between the two limbs of the clitoris, and this is where we have the opening that is referred to as the vestibule. It is within this vestibule that we have the opening of the urethra and also the opening of the vaginal canal. The clitoris exhibits the function of sexual pleasure in the aim of sexual gratification, and this is as a result of these numerous nerve endings that it has. So now let's go to the different sub-regions of the clitoris. The clitoris is divided into three sub-regions. We have the glans of the clitoris. And if you look at this image by the side, this is where we have the glans of the clitoris here carried in yellow. We see that the glans of the clitoris is the external region of the clitoris. This is the region that is exposed to the outside. And this is what is carried here at this point. We also say that it is a small chunk of the entire mass of the clitoris that is seen on the outside. The glans of the clitoris is associated with two other structures, and this include the frenulum and the prepuce. We will be highlighting more on this as we go through this lecture. The second subregion is the body that can also be referred to as the shaft. So after the glans of the clitoris, the next subregion that we would see is the body or the shaft. And this is what is harrowed in green. And this is the internal subregion of the clitoris. And if you go more inferiorly using this image, you have the root of the clitoris. And this is where you have the root of the clitoris here, harrowed at this point. If you position this clitoris in an anatomical position, you see that this glans penis will be seen in the anterior part, while this root will be positioned posteriorly. So the root of the clitoris is seen at the posterior subregion of the entire mass of the clitoris. So within the root of the clitoris is where we have the creation of the vestibule. And this is what is highlighted here in dotted black. So you see that we have different subregions of the clitoris, and the different subregions, of course, are positioned at different regions. So we'll be taking each of these subregions one after the other. We'll be describing them in details. So let's go to the glans. We already described that the glans is the external region of the clitoris, and it is referred to as the tip or the head of the clitoris. This is structurally made up of densely packed nerve endings. This region also tallies with the point where we have the union of the two leaves of the labia minora. In this image by the side, this is where we have the glans of the clitoris here, harrowed in red. Using this image below here, this is where we also have the glans of the clitoris here, also harrowed in red. If you look at it, you see that this region is the sub-region that is exposed. And if you go more inferiorly on this lateral head, you have the two lips of the labia minora. We already described this labia minora in our previous lecture on the female external genitalia. If you've not checked up that lecture, please kindly go and do so. We say that we have small inner lips within the vestibule, and these are referred to as the labia minora. If you go more superiorly at this anterior region, you see a point where the two lips of the labia minora would meet. And the point where they meet is where we have the placement of the glans of the clitoris. The glans of the clitoris is also located inferior to the mons pubis. Using this lower image, this is where we have the mons pubis here, arrowed at this point. This mons pubis is formed at the anterior union of the outer bigger lips of the labia majora. This is where we have the lips of the labia majora here, harrowed in black. So these two lips also will merge anteriorly at the mons pubis. It is also important to add that the glans clitoris is associated with some structures. So it is related anteriorly to the prepuce or the hood. If you look at this image by the side, this is where we have the prepuce here, harrowed in blue. The prepuce is a fold of skin that is seen in the anterior part. And if you go more posteriorly behind the glans clitoris, you have the frenulum. And this is the frenulum here, harrowed in yellow. So you have folds in the anterior and the posterior region of the glans of the clitoris. And these structures basically is to help place the clitoris in place and also prevent them from friction. So let's go to the next subregion, which is the body or the shaft of the clitoris. We try to use this image by the side. Remember, this outer region that is exposed is where we call the glans of the clitoris. And after this subregion is where we have the body or the shaft. So this region that is demarcated here in dotted red is where we have the body or the shaft of the clitoris. So this is what is harrowed here in yellow. This region is structurally made up of cylindrical shaped corpora cavernosa. And this is separated by an incomplete septum. If you look at this lower image, this is where we have the glans of the clitoris, while the region that is seen after the glans clitoris is the body or the shaft. And this is what is highlighted here in dotted black. If you try to take a section of this region, this is the kind of presentation that you would see. You see two corpora cavernosa, which is highlighted here in blue on both sides. And you see that this structure are separated by an incomplete septum. This is to show that they are actually structurally made up of two columns of erectile tissue. So you see these erectile tissues, which are columns of corpora cavernosa, placed in this pattern. And you see that these two structures are surrounded by a thick, fibrous, elastic tunica albuginea. So this is where you have tunica albuginea here, harrowed in ash. You see it helping to hold these erectile tissues together. But what you see within the tunica albuginea are two corpora cavernosa. And this is what is projected here in this image, where you also have blood vessels also embedded within the space. The body or the shaft of the clitoris is homologous also to the body or the shaft of the penis. If we go back to our lecture on the penis, remember the penis is also made up of the glans penis, the body or the shaft, and also the root. And this is the same structural configuration that the clitoris also presents. So the body or the shaft of the clitoris also is homologous to what is presented in the body or the shaft of the penis. We try to take the configuration of the penis here, and this region that is harrowed is where we have the body or the shaft of the penis. If you try to take a T-section along this course, this is the kind of presentation that you would see. You would see on the right side, you will see one corpus cavernosum, and on the other side, you see the other corpus cavernosum. So these two corpora cavernosa are also placed as what is projected in the shaft or the body of the clitoris. But the distinct differences that we have is the corpus spongiosum. So in this region that is harrowed here in red is where we have the corpus spongiosum. Within the corpus spongiosum, we have the urethra. Specifically, we have the spongy or the penile urethra. So this is what accommodates the urethra along the length of the penis. And these three erectile tissues are then held together by the tunica albuginea. And this is what is also harrowed here in hash. So it's almost in similar configuration, but the distinct differences that they present is the corpus spongiosum. The corpus spongiosum is not seen in the shaft or the body of the clitoris. And this is because the shaft or the body of the clitoris does not give a passageway for the urethra. If you go back to the penis, the shaft of the penis gives a passageway for the urethra. And it is through this passageway that urethra is opened to the external environment. But for the clitoris, there is a space already created in the vestibule for the urethra to be exposed to the external environment. So you see these distinct differences between the body and the shaft of the penis and also of the clitoris, even though they present similar configuration, but it's good that we're able to highlight the distinct differences that they present. So if we go back to the clitoris, at this central region is where we have the opening created. And this opening is what then allows for the opening of the urethra and also the vaginal canal. So you see that this space is already created by the limbs of the clitoris. So you see that the urethra is not passing through the substance of the clitoris, but it is opened into the space that is created by the limbs of the clitoris. The body or the shaft of the clitoris is supported by the suspensory ligament. The suspensory ligament is what connects specifically the body or the shaft of the clitoris to the pubic symphysis. This is just in a way of providing structural support for the clitoris. If you also go through the alignment of the body or the shaft of the clitoris, you see that it is bent. If you go back to this upper image, you see that it presents a form of curvature around this region. And this is why it is further subdivided into the ascending part that is harrowed here in green, which is seen to be ascending upward, and a descending part that is harrowed here in blue, which is seen to be descending downwards, just as the name implies. So because of this curvature that is created like an elbow, it's what then leads to its subdivisions. If you look at this lower image too, you see that this region that is highlighted in dotted black is where we have the body or the shaft of the clitoris. And if you look at it, you see that it creates an angulature around this region. This is where it has an ascending part that is running upward and a descending part is descending downwards. So let's drive further to the root of the clitoris. This is the posterior region of the clitoris. And if you place this structure in an anatomical position, you see that the root of the clitoris will be directed posteriorly. So it is seen at the posterior end of the clitoris. The structural components of the root of the clitoris include the cura of the clitoris, and these are paired structure. And we also have the bulbs of the vestibule or the bulbs of the clitoris, which is also a paired structure. So if you try to go back to this upper image, this region that is carved out here in dotted yellow is the glans of the clitoris. When the sub-region that is next to it, that is carved out here in dotted black, is the body or the shaft of the clitoris. The remaining region downwards here is where we have the root of the clitoris. We see that this root is made up of two substructures. We have the cura and also the bulb. The cura of the clitoris is an extension or the legs from the corpora cavernosa. Remember, in our previous slide, we described that the body or the shaft of the clitoris is made up of two bands of erectile tissues, which are the corpora cavernosa. So if you look at this image, you have the corpora cavernosa at the region where we have the body or the shaft, but this structure are held together like a single structure. And as they descend downwards to reach the region of the root of the clitoris, they are seen to be separated. And this is where they present the leg of the clitoris. This is an extension from the two corpora cavernosa that is seen around the region of the body or the shaft of the clitoris. So at this region here that is harrowed in blue is where we have one cross of the clitoris, and at the other region here that is also harrowed in blue, we have the second cross of the clitoris. So these two cura of the clitoris is what is seen as an extension from the corpora cavernosa that is seen around the body or the shaft region. Remember, we described this in details in the body and shaft region, where they are seen to be held together as a single structure. But as they get to this lower region, which tallies with the posterior region of the clitoris when placed in an anatomical position, you see that this corpora cavernosa will be divided, and this is where they are now seen as the leg of the clitoris. And this is what is harrowed at this region. This is seen as an upside down V-shaped configuration, and this is what this alignment represents. These two extensions at the root region of the clitoris are connected to the ischiopubic rami. This is where the root of the clitoris gets its structural connection or support from, and this is where it is connecting to the bony pelvis. So this is the kind of configuration that you see around this region. So if we try to represent the root of the clitoris in the male, this is the configuration of the penis. And at this region here is where we have the termination of the body or the shaft of the penis, which means that deep to this space is where we have the root of the penis that is embedded within the body space. And if you look at this structure that is located on both lateral region here, this is where we have the cura also of the penis. So as we have the cura of the clitoris, we also have the cura also of the penis. And you see that they are seen on both lateral edge here as shown here in this image. If you go back to the bulb of the vestibule or the bulb of the clitoris, which is the second structural component, this structure is seen to be located deep between the two cura. If you go back to this upper image, this is where we have the two cura here. The cross is the singular of the cura. So you have one cross on one side and you have the other cross on the other side. If you go deep to this structure is where we have the bulb of the vestibule or the bulb of the clitoris. And this is what is harrowed here in red. It is the bulb of the vestibule because the vestibule is seen to be open around the space. And it can also be referred to as the bulb of the clitoris because the structure in question is the clitoris. So this is where you have the bulb of the clitoris here around this region. So between this bulb is where we have the opening that is referred to as the vestibule. And within the vestibule, we have the opening of the urethra and also the vaginal canal. We've tried to highlight this previously. So if you go to this inferior image where we have the penis, as we have the bulb of the vestibule or the bulb of the clitoris, we also have the bulb of the penis. And this is where we have the bulb of the penis here highlighted in red. You can see that the bulb of the penis is located also between the two cura of the penis. This kind of presentation is what is also seen in the clitoris. If you go deep into the bulb of the penis, you see that this structure is a single structure. It is not separated where it will be creating the space that is referred to as the vestibule. But if you go to the bulb of the vestibule or the bulb of the clitoris, you see that the two bulbs are separated. And this is where they are creating the opening for the vestibule because the urethra and also the vaginal canal need to open to the external environment. And it is through this opening that this will be established. But in male, we do not have such opening. So this is why we have the bulb of the penis as a single image where it is not creating a space in between it. So it is taken together as a single structure. While in the female, there is an opening between the two lengths of the bulbs. And this is what is seen here in the upper image. So it's good that we're able to relate how they are distinct. And this is where they're able to accommodate the different features that they exhibit in both the male and also in the female. So if you look at the bulb of the penis, you see that along its course, we have the penile or the spongy urethra. This is where we have the penile or the spongy urethra here, highlighted in dotted yellow. You see that this bulb of the penis needs to accommodate the spongy or the penile urethra. But if you go back to the bulb of the vestibule or the bulb of the clitoris at this superior region, you see that the urethra does not run through the substance of the bulb of the vestibule or the bulb of the clitoris. It is seen to open into the space that is created by these structures. It's also important for us to add that the cura and also the bulb are not left open. They are seen to be padded by muscles. So we have the ischiocavernosome. The ischiocavernosome muscle is a muscle that is seen to run through the two cura of the penis and also the two cura of the clitoris. If you go to this upper image, this is where we have the ischiocavernosome here. This is the fibers of this muscle running over the two cura. And this is what is seen here in this upper image. This kind of presentation is also seen around the cura of the penis. So in this inferior image, where we have the cura of the penis, you also have fibers of the ischiocavernosome, highlighted in black, also running across the structure. And this is where it is helping to support the structure. This kind of presentation is also seen around the bulb. So if you go to the bulb of the vestibule or the bulb of the clitoris at this superior region, you also see fibers of muscle that are referred to as the bulbous spongiosum, that is highlighted here in white, running over also the bulb of the vestibule or the bulb of the clitoris. Where we also have the bulb of the penis, you also have fibers of this same type of muscle also running across the bulb of the penis. So this is the kind of presentation that they exert, and you see that they are somewhat similar in terms of what they present. And we've also tried to highlight the distinct features that they present. So now let's look at the blood supply of the clitoris. Clitoris is supplied by the dorsal artery of the clitoris. This dorsal artery of the clitoris is what is harrowed here in pink. You see this artery as an emergence from the internal pudendal artery. This artery is what gives supply to the skin and also the fascia covering the clitoris. Then we have the deep artery of the clitoris, that is an emergence from the internal pudendal artery. We know that the internal pudendal artery is an emergence from the anterior trunk of the internal iliac artery. This deep artery of the clitoris is what is harrowed here in yellow. And this artery is seen to supply the erectile tissue of the clitoris. And these tissues, of course, are needed to be supplied with blood during arousal. So it is this deep artery of the clitoris that provides supply for this structure. Then going to the innervation, the clitoris is innervated by the dorsal nerve of the clitoris. The dorsal nerve of the clitoris is a branch from the pudendal nerve. The dorsal nerve of the clitoris is what is harrowed here in yellow, and you see it running along the corresponding named artery. And at this region, you see them finally terminating, giving off several nerve endings around the glans clitoris. And this is what is harrowed here at this point. And this is why we say that the glans of the clitoris is a highly sensitive sub-region of the clitoris. Thanks for watching this video. Let's continue to stay glued.